To health matters now, nurses in Nigeria are expressing frustration after the Nursing and Midwifery Council of Nigeria announced revised guidelines for verifying certificates for foreign nursing boards. The new rule mandates a 2-year post-qualification experience, an increased non-refundable fee, and active licenses with at least 6 months remaining, and the verification process stretching for a minimum of 6 months. This sparked outrage among nurses who see it as an attempt to hinder their career opportunities. While the council justifies the changes as ensuring quality and safeguarding public health, nurses on social media argue the experience requirement unfairly restricts their opportunities for international careers. The hashtag NMCN unfair, hashtag say no to NMCN verification rule is set to be trending on X, with many calling the policy discriminatory and violation of their right to seek greener pastures abroad. To discuss this, we're joined by Kelvin Ossai, United Kingdom registered nurse, a public health advocate. Thank you so much for joining us on the news.
Thank you for having me. Good evening.
So tell us, how does the NMCN's revised guidelines differ from the pre-existing rule for foreign certificate verification in Nigeria and the UK?
So basically, we all know every nurse in Nigeria, or those who have left the shores of the country to UK, US, Canada, or any part of the world, know that even the NMCN, the previous process, it's still outdated, although we've been managing it. It requires you to submit documents. Even when it is the NMC that gave you the registration and license, they have your records, but they still require you to submit lots of documents, pay the sum of 65,000 naira when you already have your valid license. This is not the case for developed countries like the US and the UK. I'm currently based in the UK, and it takes a split second for you to get your license verified. And this is because for public safety and for the health of the populace, you don't need to wait 6 months or 1 year to verify that a nurse is actually fit to practice. And that is why any employer can easily go to the NMCN portal, search your name or your PIN number, and they will know if you're fit to practice, if your license is valid, and that is a way of curbing quackery. In the UK, you go to a portal, your login portal where you log in, you request to get verified. You just click 1 or 2 buttons. In 3 steps, you put the name of the organization that wants to verify you, and the NMCN automatically generates that and sends to them within minutes. There has never been any delays of up to 24 hours. But the NMCN Nigeria has decided, despite the fact that it has been taking several months, which most Nigerians have been bearing, as Nigerians, we are always very patient. But now they have made it they've made the stringent rules to say that you must have 2 years working experience. You must also wait at least 6 months for you to be verified. And they've also planned on increasing the fee. But in the UK, there is no fee. You pay no fee. In the US, Canada, and any other countries, you pay no fee. So if the NMCN really wants to protect the interests of the public, they are not supposed to have unverified nurses working for a period of 2 years. So you have a nurse working for a period of 2 years. You cannot verify if they are registered or not. You're an employer, you cannot verify. You recruit them, you cannot verify. You want to give them higher education, you cannot verify if they are qualified nurses in the country. So this rule is totally outrageous and preposterous. It is unheard of, and it is against international best practice.
So in the space of the 2 years and the 6 months thereabouts that, in quotes, they would be hibernating, what would these unverified nurses be doing?
So that is the question. Now, I've been on this news since you started this broadcast today at 6. I can't tell you categorically. You've highlighted increase in unemployment. You've also highlighted increase in crime rate. You've highlighted a lot of things, and these are the issues we are talking about. We know that in Nigeria, as we speak now, go to the suburbs, like you mentioned in Abuja, the issues you highlighted about the cost of living. In those areas, you realize that nurses are being paid as low as 20,000 naira, 30,000 naira, and you want these nurses to also wait for 2 years. Now, let's assume I'm a registered nurse, and I just finished from school, and I intend to further my studies in maybe the University of Oxford or Tennessee or anywhere. and you're telling me I have to sit back for 2 years. That is totally unfair. The morale, the drive, the motivation will be damping. I have the plan for my life, not you to determine the plan for my life. Also, we also have people who have plans for greener pastures. For example, let's just assume you're married, your spouse is in the US, and you're in Nigeria, you finish your studies. The NMCN is now saying that you cannot even go and meet your spouse or your family because you have to stay back for 2 years before you be verified. So these are the issues. Now, looking at it in a practical term, the Nigerian passport is valid. Usually we have the list valid for 5 years. So I finish my program. I have a passport which is going to be valid for 5 years. NMC is saying I have to waste 2 years of that passport sitting back and doing nothing. The IELTS exam that most people take for academic purposes and job purposes outside the country is valid for only 2 years. So that means this is going to also be expiring by the time NMCN is planning to at least verify me. But they said it will take at least 6 months after that 2 years. So meaning 6 months is the least, so it could take up to 3 years before you can be verified. So these are the issues. This
So,
is a deliberate
Kelvin,
attempt.
Kelvin,
Yes.
I, of course, I try to understand what you're trying to say, but there's an underlying tone that probably I would want to play up. Why does it seem as though nurses or medical practitioners, after undergoing their medical training and education, why does it seem as though the ultimate goal is to travel abroad? Why isn't the focus on let me get educated and see how I can contribute my expertise to improving the quality of healthcare service delivery in Nigeria?
So I can answer that question. It's just as if you're asking, why did I finish school and I want to leave the country? I want to travel and better my life.
Basically,
It is my school fees. Yes, basically, the Nigerian system is not training nurses for free. So if I train myself, I decide what I do with my life. Now, there is no statistics in Nigeria from the NMCN to say that we are brain drained or that we are short of people. Now, I can categorically tell you that the 36 states in Nigeria have at least 2 to 3 schools of nursing, which at least graduates 50 nurses twice a year. So that is 2 times. May is the exam, and then there's another one in November. Twice a year, the schools of nursing and universities and colleges graduate at least 50 nurses from every institution. So there's a lot of unemployed nurses in the country. So the people who decide to go for further their studies or to improve their career or to build their career, it is totally their choice. And also the government has not made it better at all, because we have a lot of unemployment. When was the last time the federal institution or the state announced for vacancies and these interviews? And even when they do, there is a lot of people that get unemployed. In the private sector, nurses are still being paid. I said this earlier, they are still being paid 30,000, 15,000, and that is why we have a lot of quackery in the system, because these nurses are not being paid well. So I could not finish my school and go into a practice and be paid 30,000. That is less than £300 a year in the country.
Well, Kelvin Ossai, thank you so much for your contribution. Just to quickly chip in, according to statistics, it's about 1 doctor to 8,000 patients in Nigeria. So that speaks to brain drain in the country. But then maybe these are another discussion that we'll have to revisit. Thank you so much for talking to us.
Thank you so much. Thank you for having me.